Hello everyone, and welcome to DPS Medical Terminology Advanced Part 1. NCLEX is not simply about memorizing medical words. It is about understanding patient conditions quickly, recognizing danger signs, and making safe nursing decisions. In this course, we focus on the high-frequency medical terminology that appears repeatedly on the NCLEX exam. These are the words that help you identify priorities and act like a real nurse in clinical situations. Respiratory problems are always high priority because airway comes first. Important terms include dyspnea, tachypnea, bradypnea, apnea, hypoxia, and cyanosis. Students must also recognize abnormal sounds like wheezing, crackles, and stridor. One of the most critical clues is stridor with cyanosis. This combination means airway emergency and requires immediate intervention. In NCLEX, airway problems are often the first priority. Cardiac emergencies require fast recognition. Key terms include tachycardia, bradycardia, hypotension, hypertension, chest pain, arrhythmia, and edema. Chest pain combined with hypotension is a major red flag because it may indicate myocardial infarction or shock. Nurses must quickly assess circulation, perfusion, and patient stability. The question is always who is unstable and what should be done first. Neurological assessment helps identify life-threatening changes early. Important terms include LOC, confusion, seizure, aphasia, dysphagia, hemiplegia, and pupil reaction. A sudden change in mental status with one-sided weakness strongly suggests possible stroke. Time is critical in neurological emergencies. Nurses must identify these red flags quickly and respond immediately to prevent permanent damage. Sepsis is one of the most tested emergency topics in NCLEX. Keywords include fever, chills, infection, inflammation, sepsis, septic shock, and neutropenia. Fever with hypotension and tachycardia is a major warning sign for possible sepsis. Nurses must recognize this pattern early because delayed treatment can quickly become life-threatening. Infection control and sterile technique are also essential safety concepts. Electrolyte imbalance can create sudden and dangerous patient conditions. Important terms include dehydration, fluid overload, hyperkalemia, hypokalemia, hypernatremia, and hyponatremia. Hyperkalemia is especially dangerous because it can cause lethal arrhythmias. Intake and output monitoring is also a major nursing responsibility. NCLEX often tests whether students can identify which imbalance is most urgent and what intervention is needed first. Gastrointestinal emergencies often involve bleeding risks. Important terms include hematemesis, melena, hematochezia, nausea, vomiting, constipation, diarrhea, and NPO. Hematemesis with hypotension is a serious clue for GI bleeding emergency. Students must understand the difference between upper GI bleeding and lower GI bleeding and recognize signs of hypovolemia. Safety and rapid intervention are the priority. Certain words in NCLEX questions immediately signal priority thinking. These include first, immediate, priority, initial, best, most important, most appropriate, safest, urgent, and unstable. When you see these words, stop and think carefully. The question is not asking for all possible actions. It is asking for the safest and most urgent nursing action first. This mindset is critical for passing NCLEX. At DPS, we use a simple three-step formula for clinical judgment. First, ask what is happening. This means understanding the patient's condition. Second, ask what is dangerous. This means identifying the greatest risk. Third, ask what must happen first. This means choosing the safest priority intervention. This is the thinking process of successful nurses and strong NCLEX candidates. The goal is not simply to pass NCLEX. The goal is to think like a safe and confident USRN. Clinical judgment is the true key to success. When you master medical terminology, you improve your speed, accuracy, and confidence in both exams and real patient care. This is how successful nurses think, and this is how DPS prepares you for long-term success. Start with your NCLEX journey with DPS NCLEX coaching program. Dreamers Park Solutions.